It's Monday, and that means it's time for a new episode of Interviewing People, the career cast where you can learn about a variety of careers from people actually doing the work. Today I'll be talking with Brandi Hoyng, who once walked these halls and is now a clinical pharmacist at Health Partners of Western Ohio. Brandi will be sharing about her college experience, the variety of college pharmacy programs out there, how she spends much more time with patients than one might expect, and much more. So enjoy the show. Welcome back to another episode of Interviewing People, and today we have Brandi Hoyng with us, and she is a clinical pharmacist at Health Partners of Western Ohio, and she's going to talk a little bit today about her career as a pharmacist. I know there's a lot of students that are interested in that as a career, and it's going to be good for you to hear from her to figure out if that's something that you truly want to do. So thank you very much, Brandi, for joining us today. And I'd love to have you just start out by talking a little bit about what led you to pursue a career in pharmacy.
So it basically started out with Mr. Broad's class. So we were looking into which careers we wanted to choose. And I first wanted to do physical therapy. So I started out shadowing a physical therapist, and I realized maybe it wasn't so much for me. I then kind of watched another classmate talk about pharmacy, and I was like, wow, that really interests me. I like science in general. And, you see pharmacists and your retail pharmacies and everything. And I just didn't even think of that being a career option. So I went ahead and shadowed a pharmacist, and I really enjoyed it. I really enjoyed the people interaction. And as a pharmacist too, we don't have to touch people as much. So that was also enjoyable for me as in healthcare in general. But I wanted just to help people, and through medicine, that's a huge thing as well. So I saw how much the pharmacists were very caring, and we had very similar personalities. So it was just kind of a good fit. And I did a pharmacy camp through the University of Findlay as well. So that actually really helped grow my love for pharmacy too. So that was pretty awesome before I could, start applying for colleges and stuff.
So what year did you do that pharmacy camp?
So that was my senior year, like the summer before, the summer before school and everything, I believe, like applying for schools and everything. So that was the senior year.
Okay. And does the University of Findlay still offer that?
Yeah, they do. They actually ask people for volunteers all the time. So they still have that every year if anyone's interested for it. It was actually a really eye-opening thing because you learned so much more about pharmacy in general going into that.
Is that a week-long camp, or how did that work?
It's really kind of like a long weekend type thing, and you stay in the dorms and everything overnight. So, and people come from, all over kind of thing. So if you're interested in pharmacy or even in the University of Findlay, that's kind of a good way to get a good taste of it.
Perfect. So looking at your LinkedIn profile, it says that it took you 6 years to graduate with your pharmacy degree. So I guess two questions. Number one, what is the official name of your degree? And then number two, is that typical for pharmacy to be a 6-year program, or is Findlay shorter or longer, or how does that work?
Yeah, so my degree is a doctorate in pharmacy. So that's actually how all of the programs are across the board now. It had changed maybe like 10 or so years ago, but now it's a doctorate. So with that, University of Findlay is a little bit different. So it's a 0 to 6 program. So 6 years, you actually are in the pharmacy program right off the bat. So as a freshman, you're in the pharmacy program, and then you kind of just go through like your gen eds and then your pharmacy classes after that. At other schools, it can be a little bit different. So there could be a 2 and 4 program, which is how a lot of colleges are in general. So you do like your pre-pharmacy, which is 2 years. You do a lot of the gen eds and everything. And then you have to apply to the actual pharmacy program, which is then 4 years going after that. So you apply in the middle of schooling there. 6 years is generally the most common time. I know specifically Ohio State is actually a 4 and 4 program, so that's an 8-year program altogether. So, but 6 years I think is just the most common time frame.
Right. And that 4 and 4 with a total of 8 years, is there really anything that a person would get in that program compared to the program that you had for 6 years?
Truthfully, I'm not sure. So I haven't talked to a bunch of OSU grads or anything, so that may be something someone wants to reach out to. But I do not know why they have an extra 2 years. I felt like the Findlay program was well versed in everything we needed to know going out into the pharmacy world. So I am not sure what happens in those extra 2 years there.
Okay. Okay, good. So I also noticed on your profile that you spent time as both a pharmacy resident and as a pharmacy intern. What's the difference between being a resident and an intern?
Yeah, so pharmacy intern is usually when you're still in school. I actually worked at Kroger Pharmacy. I worked at both the Krogers in Findlay, actually. And so that is where I worked in the pharmacy. I didn't get to do everything a pharmacist gets to do. I did a lot of tech work, and then I got to do a little bit of extra things. So I guess things like transferring prescriptions from one pharmacy to another, jotting down prescriptions from a physician, those kind of extra little things that you get to do that kind of help you become ready to be a pharmacist in general. So that was how an intern is. And then you can actually be like a hospital intern. So there are some people who go to a hospital and intern there during their college years. So that would be what an intern is. So basically before you become a pharmacist. As a resident, so that was actually a year after I graduated, I had to have my registered pharmacy certificate. So I had to take my boards and everything for the residency position because I'm a full blown pharmacist at that point. Residency is definitely different though, because it's a lot of projects, a lot of work. I did a hospital residency, so it's much different than doing like a retail pharmacy position. Um, you have rotations every month, and you basically just learn the ins and out of the hospital world, basically. And you have a couple of electives and things like that. It just gets you really ready for the pharmacy world and basically what you want to do after residency. So they kind of explain residency as almost like 3 years of experience because of how much is crammed into that 1 year. It's a lot of work. You do research projects, you do kind of the whole shebang there. So it's a big deal.
So that was not part of your 6 years. That was a seventh year. Now
Yes.
you say projects, so you were still doing projects for the University of Findlay, or you were doing projects for the people that with whom you were doing the residency?
It was for residency. So the
Okay.
hospital I was at, Western Reserve Hospital, they actually had a bunch of stuff for me to do. So residency programs are usually accredited by a higher organization. And so they have a list of things that you have to complete. And then you also have your preceptors every month who basically assign you things that they want you to learn or they want you to present on. So I would do like 2 presentations a month at least. I had a huge research project I had to do for the entire year. And then I had to present that at like big pharmacy organization meetings and things like that. So it definitely gets a little bit more in depth in terms of learning and presenting, and you really learn a lot. They even helped me figure out how to interview, and so on and so forth. It just really prepares you for the real world of pharmacy.
Okay. Well, yeah, that's really interesting. I had no idea that that was above and beyond the actual 6 years of college. So, as you think about the job that you currently have, can you tell us a little bit about what you do? I mean, when I think pharmacist, I think counting pills, passing pills out. Do you do any mixing to create your own medicines? Uh, how much interaction do you have with people? Can you tell us a little bit more about what your career currently looks like?
Yeah, so it's actually kind of crazy because I barely step foot in a pharmacy. So I am what's called like an ambulatory care setting. So I work at a health center, and there's actually three practitioners that are there. They each have a team of nurses and receptionists. So they see patients as a primary care provider. So they'll do like yearly follow-ups or physicals. They'll do things like kind of like an urgent care as well. So seeing their patients if they have like a skin infection or something like that. So basically it's kind of like your regular doctor's office. So I am kind of like a specialty for them. So the nurse practitioners will actually refer their patients over to me when they see fit. So I see a lot of patients with diabetes. I see a lot of patients with blood pressure issues, hepatitis C, and like COPD, asthma, and I'll see them as a full visit. So I actually bring the patients in and I do all their vitals. So I'll get their blood pressure, blood sugar, everything that I need to take to make sure that they're healthy in the moment. And then for like diabetes patients, for example, they'll bring in their blood sugar logs and we'll go over those and see how well they're doing at home with their blood sugar. We'll adjust medications at that visit if we need to. And I'll do it under the nurse practitioner. So I'll basically let them know, hey, we're uncontrolled here. We need to increase this medication or we need to change them over to insulin, those kinds of things. And then I'll put the prescription under the nurse practitioner's name over to our outpatient pharmacy that I don't really touch. So, so I get to work really closely with patients. Actually, it's a really fun thing. I really love that aspect about my job, and I get a lot of independence with it as well. So I do the same thing with my blood pressure patients. With hepatitis C, they're on really expensive medications that usually don't get covered by insurance. So I work with them on how to get that covered by insurance and use all that documentation that I do with them. And then for my lung condition patients, so asthma, COPD, I actually do what's called spirometry. So they basically blow into a mouthpiece that's connected to a software, and I can diagnose them with asthma or COPD through that. And then we go over, are they on the correct inhalers? Do they need extra medication? What kind of things do we need to do going forward? So basically, do they need to see a lung doctor? Is there something else that's underlying? So I actually get to do a lot of hands-on stuff, and it's a really cool setting, and it's something that people don't usually know about pharmacy. My name tag says, Dr. Hoyng, PharmD on it, and then I get asked all the time, wait a minute, you're a doctor? And I'm like, well, a doctor of pharmacy, I'm a pharmacist, and then they get even more confused because I'm a pharmacist and I'm not giving them pills. So, so that's definitely different than what the norm is. I do handle pills in some sense though, because med boxes. So patients that are truly non-adherent and maybe they're on 20 medications, I will set up monthly med boxes for them. So I bring them in once a month, we go through and I fill all of those up for them. And those patients too will also have underlying conditions, so I can make sure I make those changes to their medications if need to in the moment, and I can change them immediately in their med box. So it's a really cool thing. It's a really cool setting, and I love sharing that part about my job. So it's really cool.
Yeah, I would not have anticipated you saying any of that.
Yeah.
So
Yeah.
now, do you think that's because you've now transitioned to they're pretty much making everyone a doctor of pharmacy, that back in the day before everyone was a doctor of pharmacy, maybe that was more of the distributing pills and things? Or do you think that this was true even then and I just was completely unaware of it?
It's definitely a newer thing. So I think we're learning every day more what pharmacists can do. So because of like the residency situation as well, that really has opened the world up to like clinical pharmacy. So you kind of see your retail pharmacists are more just your staffing pharmacists. They're called retail pharmacists. Hospital pharmacists can also be considered staffing pharmacists when they're putting their orders in. And then you have your clinical pharmacists. So we kind of look at the big picture in terms of also underlying conditions like diabetes, hypertension, kind of what I was talking about before. Like hospitals have clinical pharmacists as well, where they go on rounds with the physicians. So they'll actually tell the physicians, hey, I think we should change this antibiotic to something else, or they need to change their IV medication to an oral medication. And I think that's all from really doing these residencies and then realizing that pharmacists not only know basics about the medication, but also what they can do to patients. And we just learned so much in pharmacy school that can really be utilized. The gist of it is basically because we've done residencies and because of how much we've learned in pharmacy school, we're able to do a lot more and like specialize in different kinds of medications as well. So I think that even physicians have learned that pharmacists are really useful. It kind of used to be a big like clash between the two because you had this pharmacist telling you what you could and couldn't prescribe, but now they are really enjoying pharmacy because they realize that we're just there to help. So we just want to make sure the patient's on the correct medications and going from there. So I
Right.
think that's also a big change as well, is just the mentality of pharmacy.
Good. Yeah, that's interesting how you are working so closely with the doctors now because that's something I've never experienced or been aware of. So yeah, that has to be better for the patient and everyone. So now with that new knowledge, thinking about the people that work in those retail situations, people that work in a hospital pharmacy, people that like you are pharmacists, but you're meeting with patients and so forth. Is there a wide range of salary based on those situations and which one you're in? Or is it more you have a degree as a PharmD and as a result, regardless of where you are, that's typically how you're going to be compensated? And I realize that obviously different employers could be slightly different, but can you give us a sense of how that all of that impacts a person's salary?
Yeah, so I'll be kind of straight up about this, but retail pharmacy is probably going to be your higher paying pharmacy. Um, Truthfully, it's the long hours that'll get you, and they know that it's not sometimes the best work in terms of like quality of life in general. You're just working at the pharmacy quite often, so whether that's like 12-hour shifts or you're working weekends, those kind of things, they know that people aren't exactly a fan of that at times, so they do offer, I guess, more in terms of salary than what I would do. However, no matter what career field you go into for pharmacy, it's always going to be a really decent size salary. So I wouldn't really expect anything super low or
Right,
anything for
right,
any kind
right,
of pharmacy. So,
right,
I mean, you have your doctorate, you get basically in the six figures for most pharmacy positions.
right. Okay. And yeah, I mean, again, maybe someone straight out of college, if they have student loans or whatever,
Oh,
they're more than happy to make that
yeah,
extra money for a little bit and then get that quality of life
yeah.
once they have some experience and so forth. So okay, well that's really good to know.
Well,
Now,
and people like retail pharmacy as well. Like some people really do enjoy it. I mean, I liked it when I worked at Kroger as a pharmacy intern, just the patients in general. And I thought I did well with it personality wise, and some people just really, really do well with it. So I'm not trying to shame the retail
right, right,
pharmacy or
right.
anything, but it is quite different sometimes than other types of pharmacy.
Right, right. Well, yeah, that's really good to know, people that are interested in doing this. So, if you had to look at what you view as the best part of being a pharmacist, what is that?
For me, it's always been the patient care. Since I work so closely with the patients, I get to see how well they're doing over time. So I'll see some of these patients like once a week because they're so uncontrolled, and we really want to make sure that their blood sugars are under control or their breathing's under control. And so I'll get to see them over time really improve. So I have multiple patients over the past couple of months even, their blood sugars have come down drastically, and you can see that in some of the lab work that we do. And because of that, tear up sometimes during the appointments because they never thought that they could get to this point. They are feeling so much better. And so I think just that aspect of, I know that I'm doing something to change someone's life for the better, is just the absolute biggest reward that I could have ever asked for. So that's truthfully for me the best part of it.
Good. So, on the other end of that spectrum, what's the least glamorous part of being a pharmacist that obviously, if you could get rid of it, you probably would, but it's part of the job?
That is hard. I mean, you're always going to have unhappy people no matter where you go. So I think that's the hard part too, is you actually can't please everyone. So you can be the nicest person possible, but they are just cranky people. And so I think, I mean, that's probably just for all healthcare in general too, is you're going to experience those people and it's going to make days really hard because you could get multiple of those people in one day. But you just have to know that the people that are nice to you and that, make it worth it, or what really keep you going. So I think it's just a hard thing you're going to have to deal with really anything. But
Right, right. Yeah, and again, the people that you're seeing maybe aren't feeling very well, and that can definitely
sure.
add to their maybe inability to be pleasant and so forth. So,
Yes,
good point.
definitely.
What's something that you've learned about being a pharmacist that you had never considered, back when you were in high school and decided, hey, I'm going to become a pharmacist? What's the thing that you didn't consider that you now are aware of?
Probably kind of what I'm teaching you today is basically there's so many things you can do with pharmacy. It's unreal. So I had a plan of what I was going to do as a pharmacist. I was going to, maybe just do retail pharmacy. I didn't know if I really liked the hospital. It seemed kind of scary to me at first. And then you get into pharmacy and you learn all of these different things and you start doing your module classes, which is your actual pharmacy classes. And you realize that it's so different than what you were expecting. And then you start realizing, oh, I really like this about this topic. How can I do this more in my everyday life? So that was a huge thing for me, was just learning what all you could do. I mean, there's even oncology pharmacists who do only chemotherapy, and there's like organ transplant pharmacists that do only organ transplant medications. So there's so many different fields you can go into. And then it starts getting overwhelming because your plan is completely out the window and you say, wait a minute, I didn't expect any of this. I honestly wasn't even thinking about doing residency for the longest time because I didn't know if I really needed it or not. And I was so grateful to have even done it because I learned so much from it. And then you realize that pharmacy is also very competitive. So you have to do things to kind of set you apart from others. So I had a plan and nothing happened in that plan
Right.
in general. So yeah.
Well, yeah, I think that's interesting, all those specialties that you just mentioned right there. I had no idea that there were pharmacists that focus specifically on organ transplants. And,
Mhm.
is that something that's, I guess, obviously we haven't been doing organ transplants forever, but is that something that's become more well known in the last 10 years, or have they been around for 50 years? And again, it's just one of those things that most people aren't aware of it.
I mean, I truthfully think that it's a newer thing as well. The clinical pharmacy role, I think, has just been kind of opened up within the past however many years. So again, too, with the physician change mindset of pharmacists can actually help us instead of being that annoying person talking in our ear kind of thing. So we also have done not only first year residencies, but there are second year residencies. So then you can go on to specialize in those second years. And that's kind of a newer thing as well. Residencies have been really pushed with pharmacy in general. So having those first year and second year residencies, and even sometimes a third potential residency, are super important to specialize in those fields.
Okay.
So yeah, it's kind of been a
Interesting.
big push lately.
Right, right, right. Well, that's good. Yeah, and I think the more people are prepared to, diagnose and treat those illnesses, the better off we're going to be. Now, with your experience, obviously you're getting into this field right in the middle of COVID and everything else. Has that impacted your um, experience starting out in the pharmacy field? Has it been a positive impact? Has it been a negative impact, or not been an impact at all?
So it's kind of crazy because I feel like it hasn't super impacted me. So COVID started when I was in residency. So I was in a hospital and it was a smaller hospital. It's up in Cuyahoga Falls, so up near like Akron, Cleveland area. And while up there, we actually didn't have a big surge. And I don't know if that's because of like all the big hospitals that are up there. But we didn't have a big surge. So it was basically just continuing on wearing a mask every day, kind of like normal. And then after residency, the one thing I will say that I guess did affect me was finding a job after residency. because budgets were low, so they weren't expecting to hire anyone else. I started applying early on, and they usually wanted pharmacists like right then and there, so they weren't wanting to wait until I finished residency. So that did take some time. But then I did get this position that I'm currently in. And when I started, they actually started seeing patients in the office again. So it was like right then I got there at a good time and they were back in the office seeing patients. So you gotta be cautious of patients with COVID because you're around a bunch of patients that could potentially be really affected by it with their underlying conditions. And then also, I mean, in the company itself, we've done a bunch of different things. So then I gave COVID vaccinations for about 4 months. So I drove up to Toledo to do that. So I was at some big vaccine clinics up there. So that actually was a big part too.
Okay.
And then recently we've started like antibody therapy injections in office as well. I'm not really as much a part of that. Pharmacists don't do a ton of injections. Usually for the antibody therapy, we do have to have a little bit more training. So I haven't had that yet. But so that's something that we're doing too. So I guess just trying to keep up with what we can do better for our patients that have COVID or how to protect them as much as possible is what we're trying to do right now.
Yeah, that's perfect. So as we wrap up, and you think back to yourself in high school, what do you know now that you wish you had known when you were a high school student?
So again, probably just going back to you can't plan everything, and I can be definitely a type A personality. So having that plan and going into college saying this is what I'm going to do, you're gonna change your mind. And even, I mean, people started pharmacy school and realized it wasn't for them either, and that's okay. So knowing that things are going to change and it's all right to change your mind and go into a different direction if need be. I think another big thing with pharmacy too is making sure that every single interaction you have is almost like an interview. So you want to make sure that you have those connections and show that you're respectful, that you're kind to each person, because you don't know what part they'll play later on in life. I have a professor who I worked for throughout college, and then I was like a graduate assistant for her. My mom actually babysat for her, and she ended up being like a referral for me later on and helped me get into residency. And she was basically a mentor for me.
Well, Brandi, I really appreciate everything. Very insightful. I learned a ton tonight that I did not already know, so that's good for me to know. And obviously, I'm sure there's a lot of students out there that needed to hear this as well. So I greatly appreciate you being willing to talk with us today. And if anyone would want to reach out to you, I'll obviously put your LinkedIn information at the end. Is there any other way? Is there a work email or something that they might be able to reach out to you?
Yeah, I actually still use my Findlay email. So it would be hoyngb@findlay.edu. So HOYNGB@findlay.edu.
Okay, perfect. All right, we'll make sure that's at the end. And I hope this year continues to go well for you. Hopefully COVID can end as to take one more piece off your plate. But I really appreciate everything you're doing. And thank you very much for sharing all of this.
Thank you.
Thank you for watching this interview with clinical pharmacist Brandi Hoyng. I hope you learned valuable information from her career story. And to be sure you don't miss upcoming interviews, please click subscribe so you'll know when the next episode is released. Thank you for watching, and as always, remember, the best part about Mondays is interviewing people.